So we're here, Dr. Vegno and I, to give you all, our public, an update in regards to where we stand in the city of New Orleans. And of course, as it relates to this COVID-19 virus that we have been combating. On last week, I had Dr. Vegno come and give you a general update, and we really pushed very aggressively to get the message out that while we were seeing an uptick, we wanted to do and urge everyone to follow the guidelines so that we can stay on path towards progress. So everyone seemed to adhere to those warnings, and we were paying close attention, multiple variables, but on last week and leading up to this week, it was centered around the positivity rate, and which was 5.2% on last week. And I have to say, today, and as we lead into this week, the city of New Orleans is now at 4.75. So that's trending in the right direction. And we didn't get here alone, meaning that people continue to demonstrate civic trust, but also demonstrate a higher level of personal responsibility. And I want to say thank you for that. In no way are we out of the woods at all. This continues to remain a very fluid situation. You've always heard me say, our actions will dictate where we go, and we as a city will follow the data, the science, and make decisions from there. So based on and being consistent, this week, and as we move in, we will not see any restrictions put in place for Orleans Parish because the data dictates otherwise. Again, this is the time to continue to double down on doing what we know works. Mask up, being socially distant, avoiding large gatherings, not letting our guard down. If I had to do a little self-reflection myself, like kids, don't let your guard down. And I know that sometimes it can be easy to do, but now it's not the time. We have demonstrated again as a city, as a community, that we're moving in the right direction. And it is my call, my plea, and even given the warning to continue to do the right thing so that we can make progress together. There is a reason why Orleans Parish has proven to be the most effective in the state of Louisiana, as well as we've been leaders in the United States of America. We can own that, and it's something that we should be proud of. And so I want to encourage, again, the support based on the guidelines that we have put forth, and also the personal responsibility that is tied to it. It's also led the way for the city of New Orleans, the state of Louisiana, to be in line to receive vaccines. And we started that this week as well. Kudos always going to my Director of Health, Dr. Jennifer Vegno, who has been just standing firm and tall every step of the way. And that is also aligned with our city employees, particularly our public safety team across the board. So with that, I want to encourage again, as we celebrate the holidays, continue to do what we know works. It's proven. It's a fact. And what's a fact is that the city of New Orleans will not become more restrictive as we move this week and into next week. Again, where we go is all contingent upon how we act. So I encourage you again to do the right thing. It's just that simple. Also, we continue to test, our community at large rates, which is how we have been able to, again, flatten the curve, be consistent towards making progress in our city. So testing sites remain available. It is quick, gets you in, get you out, and you get your results in a timely manner. So that helps And so again, let's do the right thing. I'm going to ask Dr. Avegno to come up and give you a little bit more detail, as she always does for us, and then we will answer any questions that you pose at this particular time. So thank you again, Dr. Avegno.
Thank you, Madam Mayor, as always, for the kind words. It really is a team effort here at the city. You know, we were here last week and we presented many of our data points that were pretty concerning and, you know, in some ways still are. And we asked our residents to do everything possible to prevent further spread of COVID-19. From what we're seeing and hearing, many New Orleanians took this to heart and have scaled back their activities and plans. And for that, we are incredibly thankful because we all benefit. You know, our numbers are still higher than we'd like them to be. They're higher than they were 6 weeks ago. But at least over the last week, our new cases, the rate of transmission that we talked a lot about, and of course our positivity rate, as Mayor Cantrell said, have stabilized to a certain extent. And so that's positive. Sometimes staying in place can be a win as well. So again, our positivity rate, as reported by the Department of Health, who updates it weekly, is 4.7%. And therefore, that does not trigger the threshold that would have caused our bars to close to indoor seating. So discussing this, and really it's not just that one number, as Mayor Cantrell said, it is looking at all of the numbers and all of the trends. And we've agreed that as long as we can stay this course, then right now additional restrictions are not necessarily needed. So this is and sounds like good news, but I just want to remind everyone how fragile the situation in New Orleans is and really all around us. Cases and hospitalizations continue to surge across the country and in other parts of the state. You know, I talk to other health directors regularly, and many of them are in a very bad position. We are still seeing a high number of COVID-19 patients being admitted to hospitals locally, as well as accepting transfers from across the state due to spiking case counts all around us. We're seeing record-breaking deaths nationwide on a daily basis. It is a tragedy on the day that we rolled out the vaccine. We had more than 3,000 people die in a single day of COVID-19. So this is a really tenuous situation to be in, and we, of course, will be monitoring daily, hourly, and should things take a turn for the worse, then of course that would trigger the need for additional restrictions to slow the spread and to save lives and protect our healthcare workers that you heard speak last week. So it's critical that we continue to follow the phase 2 restrictions currently in place, especially during what would normally be a very busy holiday season. Celebrating has got to look different this year. I know for myself it is, and I know for many of you, you are making different choices, and that's important. The safest way to celebrate the holidays is to stay home with your own immediate household and avoid gatherings. If you do get together with others, please keep the group as small as possible and ensure that everyone is wearing a mask the entire time, indoors, outdoors. That goes for when you are at a restaurant, a bar, or an event as well. Wear your mask all the time, except when you are actively taking that sip, putting that piece of food in your mouth. If you're doing your holiday shopping, of course, try to do it locally. There's lots of options. There's curbside. There's going when it's not peak hours, maybe off hours on a weekday. A lot of our local businesses you can access online. Those are the safest ways to get your shopping done and support our local economy. Always be mindful of those who are high risk in your family. My parents desperately want to hug their grandchildren, but they can't do it yet. And so please protect those who have chronic medical conditions or are elderly, you know, from those of us who might appear healthy but could be asymptomatic carriers. As the mayor said, our testing sites are still going strong throughout the holiday weeks. More of you have been coming to our testing sites over the last week. That is great. That's exactly what we need. So let's keep that up. I'll give you an update on vaccine efforts. As many of you know, some of you were there. I received my Pfizer vaccine yesterday as I'm an emergency physician and in phase 1A as a frontline healthcare provider. I feel great. I have had no side effects. I've had no soreness, no muscle aches. You can see where I got my shot. I'm happy to show anybody my arm, but there's no reaction around it. I've talked to a bunch of my colleagues who got vaccine yesterday as well. Most of them are symptom-free. Those that aren't had a mild headache or just a few hours of some mild symptoms and are at work back to normal. So that's really exciting. Our local hospital systems very successfully received their allocations of vaccines this week, and they are working really, really quickly. They are vaccinating lots of people. It's super exciting. Who they're vaccinating are those employees that have direct contact with patients, and that's everyone from a dietitian, food service, housekeeping, respiratory nurses, doctors, anyone who is at high risk exposure in a hospital. This is something we have spent months planning for, and it's just really exciting to see. Tomorrow, as you likely know, the FDA will be reviewing the Moderna vaccine application, so we do expect an approval and a rollout of that vaccine early next week for our long-term care facilities, and that will likely be what EMS and fire are getting as well, since they are included in that phase 1A. I've reviewed their FDA documents. Like the Pfizer vaccine, it appears that the Moderna is very safe and effective at preventing symptomatic disease with very little adverse effects. So they're remarkably consistent. We know there is a lot of information and a lot of misinformation out there about vaccines. So we are starting tomorrow doing a series of virtual outreach events to talk to community leaders and residents about vaccine efforts. And this is something that's starting tomorrow, but it's going to continue for quite some time. You can join Mayor Cantrell, Doc Griggs, one of our excellent community doctors, and myself next Monday at 1. We're going to be doing a virtual town hall. We have several others planned as well. You can find details at ready.nola.gov/vaccine. And so right now, knowing that there's some good news, but also we're still in a very tricky position, there's two important things I want to ask residents to remember. Number one, we believe that the vaccine is the way out of this pandemic, and we're going to need everyone's cooperation, because without the vaccine, it's really unlikely the pandemic is going to go away with any reasonable chance. These vaccines are undergoing all of the same steps and meeting all of the same standards that are used for developing any other vaccine that you or your kids might get when you go to the doctor, including FDA approval, CDC approval, multiple layers of safety approval. Even though they seem fast, the underlying science that has produced these vaccines has been in development for years and years and years. The City of New Orleans, the Health Department, our State Department of Health, our Homeland Security, our healthcare partners are working around the clock to ensure that getting the COVID-19 vaccine is as safe and easy as possible for everyone in the city. And the second thing to remember is we still have a long way to go. Vaccines will not be available to the general public for several months. And again, we are following the very, very strict priority rollout set by the CDC. I am not doing anything differently today than I did yesterday in terms of the precautions. I am still wearing my mask. I am still socially distancing. I am still not having gatherings. I am still washing my hands. My life is not going to change at all, except I have a little dot on my arm now. While I will be protected from against the virus after my second shot in 3 weeks, I still need to protect my family who have not been vaccinated. And so I can't change anything that I'm doing just because I'm protected, because I want them to be protected. So everybody needs to remember, no matter who you know that's got vaccinated, no matter if you've gotten vaccinated, mask up, social distance, avoid crowds. And the vaccine's going to be more effective in communities where the rate of spread is already low. So the lower we can keep our numbers, that should be a motivator to do so. And lastly, I just want to say happy holidays to everyone. Thank you, New Orleans. You are doing the right things now to protect our community, and you're saving lives in the process. So thank you.
Thank you, Dr. Vegno. So with that, Ms. LaTanya, we'll take any questions that anyone may have.
Thank you, Madam Mayor. Yes, the plan for New Year's Eve with the Florida lead drop, how will you prevent crowds in the French Quarter from gathering to try to keep these numbers low?
Right, so we'll take all the precautions that we have been taking throughout this virus. So New Year's Eve will be no different. And of course, not encouraging any large gatherings. Even with our celebration, it will not be one where people can come and observe. You know, they will be able to do so on television, but we will continue to be consistent in our enforcement efforts, but also in just how we communicate with the public and even with our visitors. This was one thing that was kind of front and center on my hospitality call this afternoon, just really encouraging the hospitality businesses to do what they have been doing, double down as well, but as we move into the holiday season.
And what if they're not followed?
What do you mean?
The crowd size, what if crowds still gather in the French Quarter or around New Orleans?
Well, you know, it's always been a challenge, right? Enforcement has always been a challenge. So we have to ensure that we are messaging effectively and appropriately, understanding that the city of New Orleans cannot do it alone. We didn't get here alone. And also incorporating our businesses, but also pushing that personal responsibility, because at the end of the day, that's what it comes down to. Thank you.
Madam Mayor, you mentioned that there are a number of things that go into making this decision beyond that percent positivity. What are some of those?
Well, some of the things are hospitalization, you know, the rate of spread as well. Looking at the level of testing even that we have, you know, remotely, like going on throughout the city. Other measures of, what are you thinking, Doc? The daily caseload, the deaths. All of these things can be found at on our website, particularly at nolaready.gov. And you can go there every day and get that update, like in real time.
I think a lot of ours were preparing for the 5% today. Were you surprised when you saw it?
Well, I saw the number before today, and I was happy to be able to share that with our hospitality community on our call. You know, I have every Wednesday at 1 o'clock. And yeah, they seem to be very happy about the progress, because again, it's not us trying to impose restrictions. It's us looking at the data and making choices based on the data. And so staying consistent and true to that, we said, hey, we're at 4.7. We're not, it's moving in the right direction. In no way we're out of the woods, but we'll continue to create and keep the level of balance as it relates to our public health and, of course, our economy. So looking at it like that. And I've always I've said, listen, this is not, we can't panic. Like, don't rush to judgment. Don't panic. When you're in the trough, kind of just lay low, be okay, be calm. And so we're being calm. We'll continue to watch the data, and we'll make decisions based on that. And this is what we've done today.
Seeing the improvement in numbers, if it continues to improve, what could be a new restriction that you would like to see loosened or?
Well, right now, you know that the state of Louisiana and through the governor has imposed restrictions that we are adhering to. And because New Orleans remains, you know, on the right track, bars are allowed to open, for example, when other parishes right now don't have that privilege. So it's just continuing to do the right thing, and we'll see how it goes. But again, based on the actions of people, based on the data, we will, you know, review and make decisions based on that. But we cannot be less restrictive than the state.
I know y'all mentioned that there are still are some concerns with hospitalizations. Are we at the point where hospitals are overwhelmed, or
They're holding their own, as Dr. Vegno will say, but I'll let her speak to that because she's in them.
Yeah, if you look at I just had a chance to look at the statewide numbers today, and I think the hospitalizations are right at 1,600. That is the peak, that is the exact same as the peak that we had in July, where, again, New Orleans hospitals were maintaining, but many, many other hospitals around the state were full. I think we're in a very similar position. I haven't seen recently, I do know that the Acadiana region, Baton Rouge region were truly full in recent weeks. And again, as we've always said, a lot of that can spill over to us. So while the state is once again kind of at a record level of hospitalizations, you know, certainly in terms of our bed capacity, we have beds. We continue to have challenges with nursing and other staff, like everywhere in the country. That's why the vaccines are exciting, because the hope is once we get all of those frontline workers vaccinated, you know, in their second shot in 3 weeks, theoretically, then they will be at far less risk of getting it and getting out. The more nurses and frontline personnel we have out with COVID, that's fewer beds that we have. So I'm confident. I really believe in our hospitals. They have done this time and time again. It is not easy for them. So please, like we said last week, if you're thinking of whether or not to have a gathering, think of those frontline workers and what that might do to them. But you know, if we can hold on for the next couple of weeks where we are, and I am confident that we can, then hopefully that'll get better. But the rest of the state, you know, might be a different story.
The advocate followed by the lens.
I just have one from wanted to know, Madam Mayor, if you could describe the meeting that you had with Lauren Daigle at City Hall last Friday, and why you felt the need to object to her proposed performance on their part.
Okay, so as it relates to New Year's Eve, I'm just so excited, one, that the city of New Orleans will be able to put a close on 2020 and bring a lot of hope and joy and upliftment and inspiration as we move into 2021. And I know that we have the talent that we need in our city to reflect who we are as a people and bring that spirit of hope, bring that spirit of inspiration, and move us into 2021. So I'm looking forward to that.
The lens.
The state and nonprofits are starting to shift resources into vaccination. The governor has mentioned using the National Guard for vaccines in the future. Obviously, that's a little ways off, but how is the city planning to make sure that those efforts don't reduce the resources available for testing other COVID responses?
Dr. Vega, would you like to respond to him? I'm not.
So we're working and have been working for months now, hand in hand with the state. You know, as you know, the national response gets funneled through the states, and we're fortunate in New Orleans to have, you know, more infrastructure than a lot of other places to help support that. A lot of this is unknown. We do think the National Guard will have some capacity to assist, whether that's actually administering vaccine or just handling logistics, because those are quite complicated. But you know, we are glad we've already started to amass our partnership through the mayor's vaccine strategy work groups with healthcare institutions, community groups, you know, faith leaders, volunteers. We have a very robust volunteer corps so that we can provide the best access for our New Orleans residents. There is going to be a period of time, we think, where we might be testing and giving vaccine at the same time. And that, you know, in one sense, it's going to be a balance. It just depends on kind of where we are. The good thing is that because of our community-based testing efforts, we have the infrastructure that has been critical to testing, and we think it's absolutely going to be critical to vaccine distribution. And so we're not reinventing the wheel. We're hoping to just sort of roll one into the other. You know, it's a big effort. We've already spent hours and hours and thousands of hours to come on it. But, you know, the fact that the vaccine is here now makes it real. And that makes us want to get up every morning knowing that we're actually at the beginning of getting this process done.
Thank you, Dr. Vega. Thank you all so much. And just know that we're looking for volunteers. We have relocated our NOLA Ready office to the first floor of City Hall, just making it easier for folks who want to volunteer to be engaged. But we do see, like any other disaster or crises that we've had to manage and move through, we couldn't do it without volunteers. And those are the people on the ground in our communities, and we just say thank you and welcome and come on and sign up to volunteer to be a part of the recovery of the city of New Orleans. Thank you so much.